It is now September 21, 2023, 1:37 p.m. here in the Senate chamber of the Honorable Jesus P. Mafnas Memorial Building. And with 5 members present, we can proceed with today's committee meeting. And just to recognize the members of the committee, we have Senator Dennis Mendiola to my far left, to his right, Senator Frank Cruz, to my far right, Senator Selena Babauta, and to her left, Vice Chair Senator Karina Magofnia. With 5 members present, I call this meeting to order. Before we begin, I'd like to entertain any motion for the adoption of today's agenda. Our motion was made and seconded. All in favor, say aye. All opposed, say nay. Motion carries. We now move on to the next item on the agenda, public comments. Before I open the floor to the public, I'd like to recognize the committee, the legislative staff assisting the committee. We have our council present with us, Antoinette Villagomez, our legislative assistant, Devin Macaranas, Sergeant at Arms Brendan Manglonia, and our IT, Del Camacho. At this time, I invite any members of the public to provide their comments on any of the 2 bills that the committee will be taking up for discussion today on House Bill 2347 and 2348. I ask that you state your name and entity you're representing, and if you can please keep your comments to 5 minutes. And after everyone has been given the opportunity to speak, I can allow additional time. Thank you. Floor is now open.
Good afternoon, Mr. Chair, members of the committee. My name is Reina Sares with the Commonwealth Healthcare Corporation's Behavioral Health Services. As a member of our CNMI community and Director of Behavioral Health Services, as part of the Commonwealth Healthcare Corporation, I believe this proposed legislation, House Bill 23-47, is another crucial step towards improving access to mental health care and addressing mental health concerns in our community. Mental health is an integral part of a person's overall well-being, and it is essential that individuals have equal access to mental health services, whether in person or through telehealth platforms. The COVID-19 pandemic underscored the importance of telehealth as a means of delivering healthcare services to those in need when in-person visits are most challenging, as well as workforce. All our island communities are remote and underserved areas, and expanded mental health services through telehealth platforms provide access, accommodation, and convenience. The draft bill also reduces stigma as it allows an individual to access affordable support from the privacy and safety of their homes and spaces if they would so choose. The bill's focus will help eliminate financial barriers that individuals face when seeking mental health support and present equitably the method of service delivery. It increases affordability and accessibility for all by ensuring insurance companies treat telehealth delivery of mental health services on par with in-person visits. I urge your support and vote in favor of House Bill 23-47. In doing so, you'll take a significant step towards improving the mental health and well-being of your constituents, our community, and promoting equal opportunities to receive appropriate and needed care. Thank you for your commitment to addressing mental health in our CNMI. I look forward to seeing our communities benefit from the positive impact that House Bill 23-47 can bring to all CNMI healthcare services and to CHCC healthcare system as it aligns with our mission to provide comprehensive, accessible, and affordable healthcare services to our CNMI community, especially impacting our people's health and wellness for the better. Thank you.
Thank you, Ms. Juarez. Are those, do you have any comments you wish to submit, or?
I believe we
Here.
submitted some already, but yeah.
Okay, thank you.
Thank you.
Good afternoon, Chair. Is this on? Okay, good afternoon, Chair Manglonia and Senators. My name is Dr. Ann Earhart, and I've been a practicing psychologist in the CNMI for 27 years. I'm here regarding House Bill 2347, a bill to establish parity in coverage and payments for mental health services delivered through telehealth and in person. And before I jump into my comments, I would just like to refer you to Section 7804, line 16 in the bill that answers the question about the ability to negotiate rates between provider and insurer.
Sorry, Dr. Ann, can you repeat that?
Yes,
page?
it's Section 7804, line 16.
Thank you.
So it's already a provision in the bill that rates can be negotiated independently if both parties so choose. My colleagues, Dr. Adrian Bren, Dr. Janet McCullough, Dr. Jennifer Maratita, and Dr. Amanda Borja Hughes and I, all licensed clinical psychologists, strongly support this bill. The CNMI currently has no telehealth laws. In particular, we have none that ensure ongoing coverage from mental health services. This means that there is no certainty that telehealth services will be covered or paid for by insurance plans. In fact, one regional insurance provider terminated telehealth coverage the day the public health emergency waivers ended on May 11th. And another has only committed to telehealth coverage through the end of this year. In addition, the CNMI joined the Psychology Interjurisdictional Compact, or PsyPact, last year in order to increase access to mental health services from qualified off-island psychologists via telehealth, as well as allowing those of us here who choose to be authorized under PsyPact to provide continuity of care to our patients who have moved temporarily or permanently off-island. Many insurers are still unfamiliar with PsyPact and therefore have not updated the information they give their subscribers about coverage and payment for care they are entitled to in their insurance plans. Most states have spent the last 2 to 3 years writing and amending their telehealth laws to permanently reflect that telehealth is here to stay, especially for mental health. Telehealth legislation has now been enacted in all 50 states, the District of Columbia, Puerto Rico, and the U.S. Virgin Islands. PsyPact legislation has been enacted in 40 states, including the District of Columbia. It's effective in 39 states and has been introduced in 2 additional states. At the federal level, the Centers for Medicare and Medicaid Services, CMS, are proposing to make permanent many of the waivers that were implemented during the COVID-19 public health emergency to increase access to care via telehealth, especially again for mental health. Clearly, telehealth is going to continue to be a service delivery model and is being built into federal and state laws. House Bill 2347 will provide clarity to insurers and our community that mental health services delivered through telehealth in the CNMI will be covered by private payers and government health plans. With this bill, people seeking help through telehealth will know that these services will be covered by their health plan, that services delivered through interstate compacts such as PsyPact will be covered, and that costs will not be higher than what they would pay for in-person care. We are very grateful that this legislation was passed unanimously by the House and is supported by the Insurance Commissioner, CHCC, CGC, and the Healthcare Professions Licensing Board. We hope to have your support as well in providing for the mental health of the CNMI. Thank you.
Thank you, Dr. Ann. And I believe all members were provided written testimony from Dr. Ann. Thank you. Floor is still open.
Hafaday Tiro, Kasilaliam. My name is Sheila Jack Babauta. I'm here in my personal capacity. And I'm here in full support for House Bill 23-47. In the past several months, I've been a part of the team led by Dr. Ann Earhart as we've engaged with multiple stakeholders and agencies in the CNMI, the Department of Commerce, Medicaid, the Healthcare Licensing Board, CHCC, CGC, Rep. Omar and House Counsel, and former Rep. Tina Sablan, Senior Policy Advisor for Governor Palacios. We've engaged with these individuals and agencies to ensure that there is full understanding and support for House Bill 23-47, and all have been really generous in assisting with the drafting of the bill, providing comments and stating their support. As a resident, born and raised here on Saipan, I really do see the need for mental health services, not just access, but coverage. And so as a part of the 22nd legislature that passed the SIPAC bill, along with my colleagues, that granted access to this network, that was a huge win. And this is really the next step to support that and ensure that there's coverage. As a recipient of services myself, I have experienced that 1 year waiting list just to see a therapist, just to seek counseling services. And I have experienced receiving services virtually, and it is really effective, and it is something that our community really needs, especially our youth. I think that with the recent bomb threats, school shooting threats that we're experiencing just this past week, it's really a sign that our community is in need of some guidance and some counseling services. So I'm here in my personal capacity to state my full support. We are here to answer any questions and serve as resources for the committee. And please know that we will be here along the way. Should you have any questions, please reach out to us. Thank you.
Thank you, former Representative Babalta. Floor is still open. If there's no one else, we will close the public comment portion of the agenda and we move on to the next item, which is new business. First up, we have House Bill 2347 entitled to establish parity in coverage and payments for mental health services delivered through telehealth and in person. If you look at the committee report submitted by the House, I've foregone several requests for comments to these particular agencies as they are provided in detail when the House had deliberated on this legislation. We have comments from Joseph Kevin, Director of the Community Guidance Center, Dr. Ann, who also provided comments today, Ms. Sheila Babauta, Dr. Munya, Ms. Jane Mack, Directing Attorney of MLSC, Ms. Velma Venaventi, Program Director for the NMIRF and GHLI, Esther Fleming, Executive Director of Healthcare Professions Licensing Board, Kraibani Hassan, Business Development, Government and Student Programs, CVS Health Aetna. And additionally, the comment that we received today from Ms. Marcia Calvo of Calvo's Select Care. All comments are in support of the legislation. Additionally, as stated prior to going on record, Calvo Select Care expresses their strong support for the legislation and asks that we include provisions that would allow for the insurance providers to negotiate fees and exclude them if fees are not successfully concluded. However, Dr. Ann pointed out that this is addressed in Section 7804, and it reads, nothing in this section is intended to limit the ability of a health insurance issuer and a provider to voluntarily negotiate alternate payment rates for mental and or behavioral health services delivered through telehealth. Nothing in this section is intended to require reimbursement for services delivered through telehealth to be unbundled from other bundled risk-based payments. And so unless members have any additional amendments they would like to include, or this section does not clearly identify, is that something that you feel doesn't address the concerns by Select Care, I at this time I open the floor to any of the members for discussion. Recognize Senator Selena Babalta.
Thank you, Mr. Chairman. And prior to the commencement of the committee meeting, I was talking to some of the professionals who are here today. And while I support the intention of the bill, I did have questions as to why we are singling out the counseling services or mental health services by, requiring insurance providers to cover them. Why not just, in the overall scheme of things, apply it to other hospital services? Because I know that CHCC in the past, and I think they still are, providing telehealth or practicing telehealth consultations with other hospitals. So if I were to strengthen this bill or to make it better or to amend it, it would be to include hospital service as well. And I get that we lack, the necessary mental health providers, the counselors, the psychiatrists, psychologists. We don't have a lot of people who go into that field, and I see the urgency for them to be able to tap into their SIPAC network to, so that patients can avail of these services. And it is certainly a policy call of this committee, whether to table this and further amend it to include hospital services. But that was just one of the questions I had when I was reading the bill. As far as other concerns of the bill, I don't really have any concerns on it. I agree with the intention of it, but again, why just limit it to mental health services, and why not include all hospital services as well? Thank you. I yield.
Thank you. At this time, if there's no objections with the members, I'd like to go into committee of the whole to invite any member of the public that would like to add additional information as to what some of the concerns are. And so if there are no objections,
No objections.
we are now in committee of the whole. And so, Dr. Ann, is that something that you can shed light on and see how we can address some of the concerns brought by Senator Babalta? In your professional opinion. Thank you.
Thank you. The necessity of a broader telehealth bill. I completely agree with that. However, it becomes much more complicated when you're dealing with medical matters and professionals, and the complications of the different departments that are necessary to be addressed. So I did try to begin that process of seeing if we could have an overarching bill, but it became clear very quickly that that was going to take a very long time to sort out and create, and we don't have that time for mental health and allowing people to have access to care and access to paid care. So again, I couldn't agree more. I think we need a broader general telehealth bill, but that will have to wait for the medical professionals to address those issues which are beyond our purview as behavioral health providers.
Thank you. I mean, the floor is open for any members to ask questions directly to Dr. Ann. Recognize
Dr.
Senator
Earhart,
Babalta.
you mentioned that there is an urgency to come up with legislation like such as this
Mhm.
before this committee. Can you inform this committee why it is urgent? I know I heard from you earlier and some of your colleagues. Can you just inform this committee about the urgency of it? That we can't wait, to have that general and broader bill or legislation to cover other hospital services?
Yeah, thank you for that question. I personally have a year-long waiting list, and I find that completely unacceptable for people who need mental health care. Usually when they call in crisis, and to ask someone to wait a year for services is unreasonable, and it's just immoral as far as I'm concerned. And we don't have any place to refer them to at this point. Or we do now, we have SIPACT, we have other people we can refer them to, but we have no guarantee that insurers will pay for that. Right now, it's at their pleasure whether they will pay for those services or not. And as I said, sometimes they're already deciding not to cover those services. So I think there is an urgency. I can't see any immediate way that the people, for example, on my waiting list are going to be seen sooner unless we have this provision available, and they've already waited a very long time. I think that realistically, having the medical community come up with a bill that would be a good overarching bill is going to take a considerable amount of time. I don't see that as a thing that will happen in the near future. And my concern is that people who need help get help as quickly as they can.
How many of your patients are seeing that their insurance providers are not covering telehealth consultations? Because I saw in the comments from the Northern Manus Retirement Fund, formerly, that government insurance does cover telehealth services for consultations with mental health professionals.
Right, and that's through Aetna, and Aetna does cover that. It's a national company, and most of the national companies do cover telehealth and probably will continue to, because it's very obvious that that's a modality that is just here to stay. Really, it's more the regional and local insurance companies that we have some more concerns about. And as I said, one has already stopped providing coverage. So what that puts us in the position of is having to stop seeing a client in the middle of services, because all of a sudden those services are no longer covered in the modality that we've been using. So that is terrible. I mean, that's, first of all, it's unethical on our part to terminate services. And yet if we don't have a choice, what do? It puts us in a terrible bind. And it's really awful for our patients to have to experience that. We've been having to alert other patients that at the end of this year, we can't guarantee that their telehealth will continue to cover services as well, whether their treatment is completed or not. This is no way to operate. So we really would like to have people have the assurance that telehealth will be covered and that it will be paid for by their insurance plans, so that when they begin services, they know that they can continue those services until they're complete.
Thank you for that answer. I was trying to get at as well, how in your population of patients that you yourself are seeing, how severely would it impact in terms of numbers? How many patients would you lose at that point?
Yeah,
Because government insurance covers it, like I said, but
right.
you mentioned the local insurances.
The
so
more
I'm-
regional companies.
yeah.
I don't have the exact figures because it's I have an office manager who handles that, and I'm sorry, I don't have those numbers exactly for you. And I also don't know what Dr. Bren's numbers are at the moment. But while that's a concern about how it will affect our patients and affect us, my concern is also the people who are on the waiting list or people who are not on my waiting list, but we need services and will need services. And that is a much bigger population as well.
How many patients are you currently seeing at this time?
Oh my goodness. It varies for me personally, it varies from 18 to about 25 per week. And that is for a private practitioner. That's a full-time practice because we have administrative work and continuing education classes and all that kind of stuff that we have to do.
Okay, and of these 18 to 25 per week, are they the same people you see the following week? I mean, I would imagine there are like walk-ins or, somebody who's,
We actually don't do
Seeing-
walk-ins
okay.
because each client has a scheduled appointment
Okay.
to see us.
so they're referrals, in other words.
They're
maybe?
referrals or they're self-referred, or we get referrals from a lot of different sources. Some of them come from the insurance company, so they'll contact their insurance company and say, I need a psychologist. Who can I see? And we're a provider, so they refer to us. So the referral sources are several. I'm not sure. Did that answer your question?
Yes, thank you.
Thank you. Any member recognize Vice Chair McLaughlin?
Thank you, Chair. Just a follow-up question. So you had stated earlier that, there are some regional insurances that will be ceasing the payment, right, of these services. And so I was curious to know kind of like what's plan B for those patients whom you're currently seeing, and when that stops, like what happens to them?
So that is a great question. What we're trying to do is find resources for them through SIPACT. But again, I can't really refer someone to a SIPACT provider without knowing that those services will be covered by their plan and paid for by their plan. So sometimes we'll continue to see people on a pro bono basis until we can make that transition. We don't have any other resources here to refer them to. So it's either pro bono, which we're a small business, it's kind of hard to do that on an extensive basis, or trying and get the circumstances arranged so that they can successfully access SIPACT psychologists and know that they'll be covered.
Thank you for that question. And I'm just, as the end of the year is fast approaching, and the concern is there for those patients who really do need those consultations, right? And should this not materialize in time for that to kick in, I was curious to know what kind of impact that would have on their mental health conditions.
And that again would vary. Some people who are in for just for fairly straightforward problems with life are probably going to be okay. But the ones who are in for more serious mental health issues are not. And that is a concern. That's part of my urgency of wanting to get this addressed and passed if possible. Yeah, thank you.
Thank you for that answer. I yield back, Chair.
Thank you. Any other member? If none, I just have one or two questions to ask before we rise back. Are you familiar with the way the deductibles work with current providers? Is this like a separate category of deductible, or is this inclusive of any additional services that they can seek at the clinic or the hospital, and they'll just be taken off of that?
So part of what the bill addresses is that insurance companies will not be able to treat services delivered through telehealth any differently. They can't charge an extra deductible. It would be part of their overall original deductible. So
Okay.
for example, for many plans, Aetna has a $500 per year deductible that begins at the beginning of the year. And there would be no, if this bill passes, there would be no additional deductible that they could charge.
Thank you. And the last question I have is there do you think there would be a huge difference if we were to, in terms of titling, to include the term behavioral health, or does mental health, does that encompass behavioral health and other health related matters?
I think at the definitions, I'd have to go look at my copy of the bill. It's been a while since I've looked at the definitions. We're using mental health and behavioral health interchangeably. SAMHSA does not. The behavioral health is the umbrella, but most people are more familiar with mental health and what that means. So we're using that term, although it is understood. And thank you. Let me just take a quick look at the definitions. Right. So if you're looking at page 2, under definitions, line 16, mental health services provider or behavioral health services provider means, and then we define that, so we're including those. And then on page 3, line 10, mental health services and behavioral health services shall mean, and it defines, so the bill encompasses both of those terms.
Right. So if this is something as simple as including the term behavioral health within the title and within this new section that we're adding, would that cause any issues, you think?
I don't think it would cause any issue. I think if we're going to pick one term, we might want to pick behavioral health, or you can say mental health and behavioral health, just so that there's no confusion. Those terms are used differently between lay people and professionals, but either term would be fine, but behavioral health would probably be the more appropriate if we're just picking one, or including it with mental health would be fine.
Thank you. Thank you. Anything else from the members? If not, thank you, Dr. Earhart. You're hereby excused. And with that, members, we now rise back into our committee meeting. This bill is still up for discussion, and I recognize any members. Recognize Senator Rubalta.
Thank you, Mr. Chairman. I'm looking at the comments from Kribani Hassan from Edna and his comments on this particular bill. There's nothing here that, informs me as to what their position is on the bill. He or she basically states that they already cover, their plans already include parity of coverage for mental health services and substance abuse, including medical and hospital services. But as to mental health services, they will come back to this committee or to Representative Omar actually, and inform him what their policy is on that. So we've already received a comment from the other insurance company that they support this bill, and I wish that Mr. or Miss Hassan would also give us comments, for or against this bill. I just wanted to state that for the record that I wish there were more comments from insurance providers. I yield.
Thank you, Senator Rubalta. Any other members? Any concerns from the members as far as adding in the term behavioral health? Recognize Vice Chair.
I don't know. Thank you, Chair. I don't know if the question should be directed at you or who, but is there like to insurance providers, is there a difference between the two words that are being used, like the terms behavioral versus mental? Like, would that cause any limitations or, just depending on which term was used? Does that make sense? I don't know. I don't know if the question should be directed to you or, but I'm just curious from an insurance standpoint if that, has any effect on the terms that are used.
I think this, and based on the comment received from Select Care at least, it's whatever services they provide for in person are services that they can also provide through telehealth, and that the coverage should be equal to what they would cover in person. And so this bill will allow to provide coverage to one or the other, but based on the conversations we've had, it seems like, at least for the most part, they address services that are being offered both in person and through telehealth. I recognize Senator Mendiola.
Mr. Chair, I think that's one of the things that Doctor mentioned, is that if we foresee that as being a problem, definition, we can probably just put it both terminology and then just use the word "and," so that if one defines it a different way versus the other, it just encompasses the whole behavioral health.
Yeah, well, and that's what I was proposing, because the definitions include both services, and so it's just a matter of being consistent with the findings and as well as the title. Yeah. Any other concerns? If not, I'd like to move that we include the term behavioral health in the title and in section 2, chapter 8, mental health and behavioral health coverage. Do I have a second? All right, motion has been made and seconded. Discussion on the motion. If none, all in favor say aye. All opposed say nay. Motion carries. Any other amendments to the bill? Any other concerns? So SD1. Correct. Yeah. So for clarification, we're amending the title of the bill as well as the title of the chapter. All right, and again, council, this is SD1. All right, discussions on what is now House Bill 2347 SD1. If there are no concerns, can I get a motion to adopt or reject?
So
bill?
move, Mr. Chair. Motion to adopt.
All right, a motion was made and seconded to adopt House Bill 2347 SD1. Discussions on the motion. Ready? Can I get a roll call on this? Thank you.
Senator Selena R. Babauta.
Yes.
Senator Francisco Q. Cruz.
Yes.
Senator Karina L. Magofni.
Yes.
Senator Dennis C. Mendiola.
Yes.
Mr. Chairman.
Yes.
Mr. Chairman, all 5 members present voted yes.
Thank you, Devin. With all 5 members voting yes, House Bill 23-47 SD1 is hereby adopted. And with that, if I can request the LA to prepare the committee report so that we can address this at our next session. Thank you. Thank you, everyone who testified on behalf of this legislation. Members, we move on to the next item. We have House Bill 2348, entitled to amend Title 4, Division 9 of the Commonwealth Code to place the apprenticeship program within the Department of Labor and to repeal 3 CMC 1351 through 1358 in their entirety and for other purposes. Discussion on the motion. Discussion on the bill.
I do, Chairman.
Recognize Senator Babauta.
I have serious concerns about this bill. It proposes to repeal an entire section, actually sections 1351 to 1358 of the apprenticeship program and short recess, please.
Short recess. All right, we now rise back from recess, and we are still discussing House Bill 2347. Based on the conversations we've had amongst ourselves, we've determined that we will like for NMC, particularly the individual in charge of this apprenticeship program, if it's still in existence, NMTI and Department of Labor to come before the committee to answer additional questions that members have. And so with that, I will request for a date when all three entities will be available, and then I'll share that with the members. And so I will table 2348 upon confirmation of those dates. All right. With that, members, we move on to the next item. Miscellaneous or announcements? Any members? If none, if none, can I get a motion for adjournment? Recognize Senator Babauta.
Mr. Chairman, I move to adjourn today's meeting, subject to your call.
All right, motion was made and seconded. All in favor, say aye. All opposed, say nay. Meeting is hereby adjourned at 2:34 p.m.